Hello, good morning. I am Dr. Vishwas. I
Good
am
morning,
doctor
doctor.
of this clinic.
Yes,
May I confirm your name and age, please?
yes, doctor. I'm Sylvester Stallone, 45 years.
Okay. I have got a letter from your GP saying that you have blood in your water. Is it right?
Yes, doctor. It's right, doctor.
So I'm going to take detailed history about your condition, and during our discussion, I may take some notes, but all the information during our discussion will be remain confidential. So is that okay with you?
Yes, doctor. It's completely okay.
So can you please tell me that what is happening with you?
Doctor, actually, for the last 4 days, doctor, I am facing that there is some blood coming out, okay, of my water work. So I have had this episode once before, uh, 2 years back, and now I again having this. So I'm a bit nervous, doctor. What's going on?
I'm sorry to hear that. And can you please tell me when did you notice it at in the morning time or in the evening time?
Doctor, I noticed it. I think 4 days back, after getting up from bed, I started noticing it. Okay.
And is it present every time in the last 4 days?
Every time, no, doctor. I don't think that it's present every time, doctor. But every day I have faced it, doctor.
And when do you face it? In the morning time or in the daytime or night time?
Well, doctor, I think I face it more in the morning time, doctor.
Can you tell me about that if it is mixed with your water all the time or just you start at the beginning time when you start passing your water or at the
I
end?
think, doctor. I think it's almost all through the whole my water work. Okay, I feel that it's like the same.
Can you tell me the color?
Yes, doctor. I think it's more a bit dark red, doctor.
Okay. And all the time it is dark red or was it frank red before?
Doctor, I don't think it was totally red anytime. Okay.
And for a day, suppose for last 24 day, sorry, for last 24 hours, how
Yes.
frequently you have noticed this?
Doctor, I think I have noticed it for 2 or 3 times.
And all were in the morning time.
I think it's more in the morning, doctor. As I usually go for water work 8 to 10 times a day. I think I've been experiencing it for 3 to 4 times highest. And as the day goes by, I think I feel better. The color is also much more normal.
Okay. And do you feel any pain or any abnormal sensation during passing your water?
No, doctor.
It is maybe somewhat a private question, but may I know that is there any soreness or any ulcer around your private parts?
No, doctor. No, no, no.
Any abnormal discharge, any whitish discharge, or anything?
No, doctor.
Okay. And do you have any raised temperature or fever?
No.
Any pain in your tummy?
Yes, doctor. That's another thing, doctor. Uh, I have some pain in my tummy, doctor.
Can you tell me where it is?
Doctor, I cannot specifically tell you, doctor, but I think sometimes I have this pain over my tummy. Okay, and not only that, at times my tummy gets bulky, doctor. All of a sudden, I can get it.
For how long you have experienced this?
Doctor, I experienced these problems more or less uh, 3 or 4 times in my life. That suddenly my tummy gets swollen, gets bulky. Okay.
And did you seek any medical attention for that?
Well, doctor, usually it goes away within 2 or 3 days. I think that's due to some gas. People say that there many people are suffering from gas problems. I also think that's the same thing. But still, you asked me, I told you this time.
Okay. So I am going to ask you a few other questions. That, do you have any headache?
No, doctor.
And have you noticed any changes in your vision?
No,
Any changes in the color of your eyes?
I haven't noticed, doctor.
Any rash anywhere in your body?
Yes, doctor. How can I tell you that? But I have some red spots, doctor. Okay. Uh, and it's painful, doctor. Some red spots, painful. So these are at times quite irritating, doctor.
Where it is?
Doctor, it's both in my arms and legs, doctor.
For how long?
Doctor, I think I've been facing this for the last 15 days.
And did you seek any medical attention for that?
Uh, no, doctor.
Yeah, okay. And is it
I just took
increasing?
some over-the-counter medication, some painkillers, but I don't think that they have worked very much good.
Is it increasing?
Uh, no, doctor, it's more or less the same, doctor.
And do you have noticed any changes in your weight?
No,
How about your appetite?
it's good, doctor.
Any changes in the skin, like skin tightness or anything else?
No,
Do you have any hot or cold preferences?
no,
Any cough?
no, doctor.
Any shortness of breath?
I haven't noticed, doctor.
Any racing or pacing of your heart?
No,
Any lumps or bumps anywhere in your body?
no, doctor. Just I told you that there is some skin condition in my hands and legs.
Do you have any joint pain?
No, doctor, I haven't noticed anything like that.
Okay. Have you noticed any changes in the blood clot, or did you have any problem with your clotting?
Doctor, I personally don't know about it. Okay, I just have these problems.
Have you noticed any swelling in your legs?
No, doctor, I haven't noticed.
And this type of blood in your water have occurred before. Did you seek any medical attention at the time?
No, doctor.
And did it go away on its own, or did you take any
Yeah,
medication?
they were always on its own, doctor, within one day. So I just thought that I was might be there was some previous day meal issues might be present. So I didn't take it serious actually.
Do you have any known past medical condition?
No,
Any history of jaundice?
doctor. No, doctor.
Okay. So, do you take any medication right now?
No, doctor. I told you that I had been taking some medication for the skin condition. I told you. Other than that, no other medication.
Do you take any herbal products or any over-the-counter medication?
No,
Do you have any allergy to any medication?
not that I know of.
And any of your family members have any problem with their blood clotting or any other medical attention, that any other medical condition,
Doctor, I don't actually know much about it.
any history of abnormal death in your family?
No, doctor.
Is it okay if I ask you few personal questions?
Yes, of course, doctor. No problem.
Do you smoke?
No, doctor.
Do you drink alcohol?
Yes, doctor. Yes.
Uh, how many units for how long?
Doctor, it's not just it's regular, sir. Doctor, sometimes I don't drink at all. Sometimes I drink 2 or 3 units a day.
And if you don't mind, may I ask you few personal questions? They are very personal.
Okay.
Do you take any medication or any IV medication or any IV drugs?
What is IV, doctor?
Any drugs that you take through your blood channel?
Oh no, doctor, never.
Okay. Did you have any making a tattoo?
Oh no,
Do you have any history of blood transfusion previously?
no, doctor.
Okay. And may I know that are you living alone or with any partner?
Doctor, I live with my wife, doctor.
And did you have any other casual relationship before?
No, doctor, no casual relationship, doctor. I'm a very loyal person.
Okay. And may I know that you have this type of condition and before onset this blood in the water, did you take in any excessive exercise or any excessive amount of alcohol?
Doctor, around 5 days back, doctor, actually, we were watching sports. We all are friends. And actually, it was a Real Madrid versus Barcelona match, and Barcelona won. So actually, we had all of our friends had some drinking, doctor. And I think I drank quite a bit more, doctor.
Okay. And have you noticed that anything makes this condition worse? Any food or anything?
Oh, no, doctor, I haven't noticed, doctor.
Anything that makes it better, like just taking much more drinking water or anything?
Oh, no, doctor, I don't think so.
Have you eaten anything than the usual thing, like any colorful fruits or anything else?
No,
Did you get any injury before onset of this symptom?
no, doctor.
And may I know that what do you do for living?
Doctor, I told you that I love football. So now I'm a football coach, doctor.
At this point, may I know that what is your concern?
Doctor, what is this actually? Is this cancer? I have known, heard that when this type of blood comes out or some discolored waterwork comes out, there is chance of cancer. So is this what's happening to me?
Actually, at this point, I need to examine you, then I could give you the best explanation. And at this point, it seems likely that it is not likely to be cancer, but it likely to be a condition that is problem with your blood channel. And I am thinking that it is related to your rash in the hands and feet that we call it vasculitis. Do you get me?
Okay, doctor. Okay, doctor.
For this, I need to run some blood tests, some imaging test, and after that, I can give you the best explanation.
Okay, doctor.
And in the meantime, I will advise you not to drink. If you need help, I can refer you to the alcohol cessation clinic.
Okay, doctor. Okay.
And as soon as the test results come, I am going to arrange another meeting. And I'm going to give you the best explanation about our further management.
Okay, that's all right. Okay.
Do you have any other question for me?
No, doctor. Well, can I continue with my job, doctor?
Okay, actually, strenuous exercise can aggravate this condition, so we will try to refer you to the occupational health department, and they will be able to adjust at your job.
Okay, doctor. Okay, that's all right. Okay. How much time remaining?
Uh, 1 minute.
Uh, okay. Okay. So will you complete the conversation now?
Yes.
Okay. At this moment, would you like to do some tests or some examinations?
Okay. I need to examine this patient first. I need to examine the pulse if there is any irregularity.
No, it's all right.
Then I need to see for any signs of rheumatological condition.
No rheumatological condition.
Then I would like to examine the ulcer, examine the rash.
Ulcer. No, sorry. There is no rash. There are actually tender red nodules. Okay, raised painful nodules, and there are one or two, I think, necrosis also present.
Okay. Then I need to examine for numbers, extension, if there is any scar mark present.
No scar mark present, doctor. I think it's around 10 to 15 in number.
Okay. And where it is.
I told you that, doctor. Arms and legs.
Okay. And after that, I need to examine the eyes for any redness, any anemia, and jaundice.
No, eyes are quite all right.
Okay. Then I need to examine the tummy for any organomegaly, any tenderness.
Yes, there is hepatomegaly present
Okay. And
and ascites present.
any tenderness.
Yes, there is tenderness present all over the tummy. Hepatomegaly present and ascites present.
Okay. After that, I need to examine the legs for any peripheral edema.
No, such it.
Okay. At this point, I need to examine the pulse, examine the blood pressure, and urine for diagnostic test.
That's all right.
Okay. This
In
is
urine for dipstick test, there is no RBC present.
okay. Okay, this is all.
Okay. 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 So that's all right. Now, what do you think the diagnosis can be in this patient?
Okay, for this gentleman, I have a few differential diagnoses, not a quite uh, straightforward diagnosis. That this can be a case of cryoglobulinemia that is associated with hepatitis C virus. Then it can be a case of porphyria cutanea tarda. It can be associated with paroxysmal nocturnal hemoglobinuria. Then
Okay.
this also can be associated with his excessive alcohol consumption. That it is a case of chronic liver disease with chronic liver disease with bleeding manifestation. That is chronic liver disease, though
Okay.
it's unlikely. And it also can be a case of hypercoagulable condition that is
Okay.
giving rise to frequent ascites and hemoglobinuria.
Okay. Okay. So regarding the pattern of his complaint, what do you think? Which differential would come first?
Okay, after examination and with this history taking, it can be a case of porphyrin disorder,
Sorry, porphyrin.
porphyrin disorders.
Okay. And well, do you think in porphyrin disorders there can be such hepatomegaly and such ascites?
Uh, okay, this can happen.
Okay, but does it happen so regularly? Do you think?
No,
He told that there have been 4 episodes.
no, I'm not quite sure.
Okay, okay, that's all right. Actually, the pattern of morning dark urine it goes more in favor of PNH, paroxysmal nocturnal hemoglobinuria. Okay,
Okay,
so and what I told that there were repeated ascites and hepatomegaly, it goes in favor of Budd-Chiari associated with PNH. Okay,
okay,
and those actually there were dermal papulas. Okay, the tender even the skin can be involved in dermal vein thrombosis can be present. Okay, what when there is a tummy pain or abdominal pain, it can be both due to Budd-Chiari and also it can be due to mesenteric vein thrombosis. Okay, and sometimes even dermal vein thrombosis can occur. In these cases, there can be raised painful nodules in the skin. Okay, and these were the main points. that were in favor of PNH. Okay, and that was actually quite straightforward when I told that they were repeatedly in the morning. Okay, and other diseases were all right because praglobulin could be present here. Even I think the polyarteritis nodosa you can also tell, although it's highly unlikely that renal involvement is present, but I think glomerulonephritis can be sometimes present. I'm not sure at this moment, but it's highly unlikely polyarteritis nodosa. And PCT, I'm not sure whether, but you in PCT I think you can change about tell about some color change of urine as well. You told about it, but I think PNH and other vasculitities, you excluded it very well. I also told that there were actually no symptoms of other vasculitities as well in this patient. However, that's all right. And now, how would you like to investigate the patient?
First, I will go for the routine blood test, that is complete blood count to see anemia and white blood cell count level, then inflammatory markers. After that, liver function test, renal function test, and urine for routine examination. After that, I will go for the clotting screening, and it is and also there I will go for the urinary porphyrin levels, and
Okay.
after that urine for hemosiderin level. Then
Okay. Well, what do you think? What is the main diagnosis? I told that it should have been for paroxysmal nocturnal hemoglobin. Okay. So what is this actually? What happens? It's actually a cause of hemolysis. Okay.
okay, for this
So
to find out that is some special CD 57 and 59 assessment. It's,
yeah, 55 and 59. Okay. And so there can be some tests for intravascular hemolysis as well, like LDH, reticulocyte count, haptoglobin count, okay, hemoglobin urea and hemosiderin.
okay,
Is that right?
okay,
Yeah. And then flow cytometry. I think flow cytometry is enough. If you can't remember CD 55, 59, just tell flow cytometry of peripheral blood, okay? And
okay.
even bone marrow analysis can be done. Okay. So now how would you like to manage this patient?
Okay, what is the findings in bone marrow?
Findings, there can be in hemolytic phase, there can be some hyperplastic bone marrow, okay? Irregular hyperplastic bone marrow during hemolytic phase. And even there can be some hyperplastic bone marrow in aplastic phase. These patients can sometimes present with bleeding infections as well, and that can be an important finding, although not very diagnostic, but you can tell this. Okay.
Okay,
And and now, can you please tell me about which about the management in this patient?
okay. Management first, educating and counseling the patient about his condition. Then management is a multidisciplinary approach. There are some non-pharmacological management like alcohol cessation, and after that involvement of the hematologist, then
Hmm.
involvement of the hepatologist, and involvement of the occupational health therapist, involvement of the specialist nurse, in this case involvement of the GP, and there
Okay.
are certain medication that can help some or, some antibodies, that is I forgot, like alemtuzumab,
Isolizumab, okay. Hmm.
isolizumab. Okay.
Okay, okay. And is there any curative treatment?
Actually, the curative treatment is bone marrow transplantation.
Yeah, that's all. Very good, very good. And okay,
There,
and
there are certain
uh,
other medication I forgot their name.
yeah, yeah. Okay, okay. You should have should go for treatment of thrombosis, treatment of anemia, and sometimes if bone marrow hyperplasia is present, you can also give anti-thymocyte globulin. Okay, and
Thymocyte globulin.
anti-thymocyte globulin. Okay,
Okay.
okay, that's all right. And can you that was actually the discussion. And can you tell me that what can be the precipitants in this patient of PNH?
Okay. Some precipitations like dehydration, then stress, then injury.
Yes, exercise and alcohol, binge drinking specifically. Okay,
Okay.
exercise and even infection itself. can be a trigger. Okay. So is that all right?
Okay.
And do you yourself want to add anything?
No, I didn't know
Okay.
that it causes dermal vein thrombosis.
Yeah. I studied it, and actually when I found, then I gave you this because I knew that it would have been a very difficult case at that moment. I knew that it's very difficult. When I tell you that there are some painful rashes, I think you would definitely go in favor of vasculitis. It's very normal. Okay. So that's why I gave it, and specifically I actually omitted any leg swelling, so that you don't traditionally think about that thrombosis. Usually in thrombosis we always go for leg swelling, but it might not be the case all the time. Am I right? It can also
Yes,
be
first I
brachial.
thought that it is a hepatitis C related cryoglobulinemia that is causing
Yeah,
vasculitis, and also hepatitis C causing
yeah. That's all right, but
or megaly.
uh, yeah, that's what is all right. But the type of red urine, uh, dark urine, what I told, that was too much specific. Okay. Hmm. So that was specific for it. So I think okay, that I think that was a bit complicated case. Okay. Okay, that's all right. I think you can stop.